Senator Risa Hontiveros is recognized to sponsor the measure.
Salamat po, Mr. President. Mr. President, distinguished colleagues, magandang hapon sa inyong lahat. I rise to sponsor a measure that seeks to establish a tertiary specialty hospital for geriatric care under the direct control and supervision of the Department of Health, the Philippine Geriatric Center. Together with Senators Mark Villar, Lito Lapid, Jinggoy Estrada, Bongo, Loren Legarda, Erwin Tulfo, and Majority Leader Mig Zubiri, we recognize the urgent need to respond to the healthcare challenges of our senior citizens and the rapidly aging population of our country. While we celebrate increased longevity as a sign of progress in health and wellness, hindi po natin maikakailang habang humahaba ang buhay, posibleng dumarami rin ang ating mga karamdaman. High blood, diabetes, arthritis, dementia, at iba pa. Many of our elders suffer quietly, often without access to proper care or support. Sa kasalukuyan, napakakaunti pa lang ng geriatricians, mga doktor na espesyalista sa pangangalaga ng nakatatanda. Wala ring sentro at espesyalistang ospital at programa na nakatuon sa kanila. That is why we need the Philippine Geriatric Center, a specialized hospital that will deliver affordable, quality, people-centered hospital care for senior citizens, promote integrated nationwide geriatric health services in partnership with DOH, LGUs, and other stakeholders, advance research on aging-related diseases, and translate findings into policy and specialized care. Provide consultancy and technical guidance to set standards in geriatric care across healthcare and residential facilities. Support the creation and maintenance of senior citizens' wards in government hospitals, and provide education and training in geriatric care for healthcare professionals, social workers, and community volunteers. Mr. President, this measure is not just about healthcare. It is about honoring our elders, ang ating lolo't lola who raised us, guided us, and kept our families close. It is about ensuring that they live longer, healthier lives with dignity and access to care. Through this bill, we aspire to celebrate old age with care. Para sa ating mga nakatatanda, ang Philippine Geriatric Center is more than a hospital. Ito ay haligi ng isang lipunang tunay na mapagkalinga. Maraming salamat po, Mr. President. Mabuhay ang ating mga senior citizens.
Thank you, Senator Hontiveros, Majority Leader.
Thank you, Mr. President. Again, one of the happy bills that our good sponsor always passes. I'm sure this will be to the benefit of so many of our elderly members of the community. We'd like to also recognize to co-sponsor the measure Senator Erwin Tulfo, Mr. President.
Senator Erwin Tulfo is recognized to co-sponsor the measure.
Thank you, Mr. President. Thank you, Majority Leader. Mr. President, distinguished colleagues, I rise today to co-sponsor a measure that not only speaks of policy but of the heart, an act establishing the Philippine Geriatric Center. How a nation treats its elderly reflects its moral strength. Our senior citizens deserve more than our gratitude. They deserve a health system that recognizes their unique needs and treats them with dignity. Ang mga bata po dito sa ating bayan, Ginoong Pangulo, may pediatrics hospital tulad po ng National Children's Hospital, ang Philippine Children's Medical Center. Ang mga kababaihan po may obstetrics at gynecology clinics at maternity centers. Nararapat din ang ating mga nakatatanda may geriatric center. Their bodies and minds change in ways that require special attention, and they deserve doctors trained to understand complexities of aging, from chronic diseases to cognitive and physical decline. The establishment of the Philippine Geriatric Center, Mr. President, goes beyond merely designating geriatric wards or units in hospitals. It envisions a national center of excellence, a premier institution for elder health that will Number one, provide specialized and integrated medical care. Two, train future geriatric specialists, nurses, and caregivers. Three, advance research on aging and age-related diseases. And four, serve as a hub for policymaking and community outreach programs for the elderly. Mr. President, we have seen it all. Ang mga lolo't lola na nakapila ng mahaba sa ospital, hawak po ang reseta, umaasang matitignan ng espesyalista. Some endure pain in silence. Others give up treatment altogether because of cost, distance, or lack of specialists who truly understand the conditions. This measure seeks to change that story by bringing the right care closer to them. That is why we filed Senate Bill number 596 to bring medical care closer to every Filipino elderly. Our goal is to strengthen our healthcare system for the elderly by making it affordable, accessible, and sustainable. Opo, malaking tulong po ang senior discount sa mga gamot at pangunahing bilihin. Ngunit higit pa po roon, kailangan po nila ng mga pasilidad na akba sa kanilang kalagayang pangkalusugan. According to the Commission on Population and Development, by 2030, the Philippines will officially become an aging population. Mr. President, 2025 na po tayo, 5 taon na lamang po yun. And let's be honest, Mr. President, lahat po tayo ay tatanda. Kung susumahin, halos kalahati nga ata ng miyembro ng ating kapulungan ay senior na. So this measure is not just forward-looking, it's personally relevant. Malapit po sa aking puso ang mga nakatatanda. They once carried the nation on their shoulders. Sila ang nagkalinga, nagsumikap, at nag-aruga. Now it is our turn to carry them with respect and with love. Mr. President, this measure is an investment not just in health, but in humanity. I proudly co-sponsor this measure and urge my colleagues to support the same. Maraming salamat po, Ginoong Pangulo, at sa ating mga mahal na kasama. Thank you.
Thank you, Senator Tulfo. Majority Leader.
May we recognize Senator Robin Hood Padilla.
Senator Robin Hood Padilla is recognized.
Ginoong Pangulo, mga mahal kong kasama sa Senado, tumatayo po ako upang ipahayag ang aking pagnanais na maging co-sponsor ng panukalang pagtatatag ng Philippine Geriatric Center o Senate Bill number 1509 sa ilalim ng Committee Report number 13 na magiging isang tertiary specialty hospital para sa pangangalaga ng ating mga nakatatandang kababayan, mga senior citizens. Alam naman po lang lahat, at hindi po ako naglihim, ng aking mahal na ina ay sa kasalukuyang po ay may demensya at pinangangalagaan po ng 3 caregivers at 7 mga anak. Anumang panukala na nagbabalik ng dignidad sa ating mga nakatatanda, susuportahan ko po ito. Sila ang mga ugat ng ating lipunan, mga ilaw ng ating tahanan, ngunit madalas silang hindi napapansin. Unang napapabayaan at huling nabibigyan ng espesyal na pangangalaga. Ngayong 20th Congress, naghain din po ako ng panukala, ang Senate Bill number 20, ukol sa pagkakatatag ng nursing homes for senior citizens. Kaya malapit po talaga ang aking damdamin sa ating mga magulang, lolo at lola. Pinupuri ko po si Senator Risa Hontiveros at ako'y nagpapasalamat din po kay Senator Erwin Tulfo sa kanilang malasakit at inisyatiba sa ilalim ng panukalang ito. Maraming salamat po.
Thank you, Senator Robin Hood Padilla. Majority Leader.
Thank you, Mr. President. Mr. President, I too have a sponsorship speech to make. I also filed the measure. I'd just like to insert it for the records, or insert it into the records rather, to hasten the proceedings, Your Honor.
So inserted.
And also Senators Christopher Bongo, Senator Mark Villar, and Senator Jingo Estrada would like to also have their speeches inserted into the records.
Well noted and inserted the records.
Thank you, Mr. President. Mr. President, I manifest also that a related measure, Senate Bill number 1500, authored by Senator Camille Villar, which covers the same subject matter as the measure presently under consideration, has been subsequently filed. At the proper time, a motion shall be made for its inclusion into Committee Report Number 13 upon its referral to the committee.
Yes,
So
I will
for
take note of that.
manifestation. Thank you, Mr. President. Mr. President, to allow our colleagues to study the measure further, I move that we suspend the consideration of the measure.
Is there objection? There being none, motion is approved.
I move, Mr. President, to transfer from the calendar of ordinary business to special order Senate Bill Number 1508 under Committee Report Number 12. I so move.
Is there objection? There being none, so transferred.
May we request the Secretary to read the title of the measure?
Subjection, hearing none, motion is approved. Consideration of Senate Bill Number 1508 is now in order. The Secretary is directed to read only the title of the bill without prejudice to inserting into the record the whole text thereof.
An act authorizing the Department of Health to set and approve the bed capacity and service capability of all DOH hospitals.
Mr. President, I move that we recognize the sponsor, no other than our distinguished Deputy Majority Floor Leader, Senator Risa Hontiveros, to sponsor the measure.
Our Deputy Majority Leader, Senator Risa Hontiveros, is recognized.
Salamat po, Mr. President. Mr. President, distinguished colleagues, magandang gabi po sa inyong lahat. I rise today to sponsor a measure that is both urgent and transformative, the DOH Hospital Bed Capacity and Service Capability Rationalization Act. This bill addresses the long-standing challenges of our DOH hospitals and the regulatory bottlenecks that prevent them from meeting the needs of our people. The substitute bill, authored by this representation, together with Senators Pia Cayetano and Jinggoy Estrada, streamlines the approval process for increasing authorized bed capacities and hospital service capabilities. It also requires the DOH to regularly update and implement the Philippine Health Facility Development Plan, PHFDP, a living blueprint to guide modernization, optimize capital investments, and upgrade hospital facilities and equipment. The goal is simple and urgent: responsive, efficient, and quality hospital health care aligned with the actual needs of our population. Right now, DOH hospitals are under extreme strain. As of June 2025, mayroon lamang ang gobyerno na 60,395 hospital beds. At sa parehong taon, may naitalang 114,251 bed capacity gaps ang DOH based on its target of 2.7 beds per 1,000 population. The estimated bed increase for this year is 29,000. Increase for this year is 29,334. At inaasahang sa 2040, ang ating bed capacity gap, kapag hindi natugunan at naaksyonan, ay tataas mula 114,251 to 188,943 beds. And with a current occupancy rate of 136%, far above the recommended 80 to 85%, our government hospitals are naturally overcrowded, understaffed, and under-resourced. The consequences are clear: longer waiting times, delayed treatments, and limited emergency response capacity. As apex referral hospitals under the Universal Healthcare Act, these facilities are central to our healthcare provider networks. Yet, regulatory requirements, especially the need for legislation to increase capacity, delay critical expansions, sometimes for 21 months or even up to 3 years, leaving hospitals unable to meet the rising demand of our kababayan. Sa simpleng salita, ang kasalukuyang proseso ay mabagal at nakakasagabal sa pangangailangan ng ating mga ospital. Ang sakit, trauma, at emergency ay hindi naghihintay. Hindi pwede na ang batas ay laging nahuhuli sa pangangailangan para sa hospitalisasyon, para sa buhay at kalusugan. With the passage of this bill, we can fast-track modernization, align resources with actual demand, and strengthen compliance with universal health care. The PHFDP becomes a living guide, ensuring hospitals can respond efficiently to both everyday healthcare needs and emergencies. Mr. President, dear colleagues, this is not just about beds or equipment. It is about every Filipino, regardless of income, receiving timely, quality hospital care when it matters most. It is about a government that responds, adapts, and invests strategically in the health of its people. I appeal to my colleagues to support this measure, not just as a legislative priority, but as a moral imperative. Para sa mas maayos, mas mabilis, at mas accessible na hospital care at serbisyo sa bawat Pilipino. Marami pong salamat, Mr. President.
Thank you, Senator Hontiveros. Majority Leader.
We recognize Senator Erwin Tulfo, and after which Senator Robin Hood Padilla.
Senator Erwin Tulfo is recognized.
Thank you, Mr. President. Mr. President, my dear colleagues, I would like to manifest my support for Senate Bill number 1508. First of all, I would like to thank Senator Risa Hontiveros for sponsoring this important measure. Yehey, palakpakan po tayo nung inanunsyo po ng Pangulo. Zero billing nung pong last SONA. Napakaganda pong pakinggan, wala kang babayaran. Provided yan ay DOH hospital. Ibig pong sabihin, wala kang babayaran. Pag yung ospital na yan ay sa gobyerno, pinapatakbo ng Department of Health. Pero may problema po, Ginoong Pangulo. Kulang na kulang po ang mga kama sa mga DOH hospital. Pag may pasyente, isang mahirap po na pasyente magtutungo sa ospital, ang sasabihin, wait. Mag-aantay po. Anong sakit? Tatanungin muna. I'll give you an example. A niece of a friend of mine went to check in at the National Children's Hospital last week. Positive po sa dengue. Tinignan ho, hindi pa masyado malala, balik na lang ho kayo. May dengue. Bakit po? Puno po kami. That was the reason. Mr. President, I think it's high time that we really look into this problem. Yung sinasabi pong zero billing po sa government hospitals ay nagiging wala pong saysay because of the fact na ang lahat po, kahit ngayon pong oras na ito, magtungo ka sa isang government hospital, wala pong kama. Parang ika nga may kasabihang paasa. So pagpunta mo, napipilitan po yung mga mahirap nating kababayan sasabihin walang kama. E nagmamadali po. This is the reason why, Mr. President, na karamihan sa mga kababayan natin na cannot afford ay pupunta po sa mga private hospitals tulad ng St. Luke's, Capital Medical Center, Cardinal Santos at iba pa. And they just worry about the payment after. Andiyan po pipila. Magtsatsaga pong pipila sa Department of Health para makakuha ng MAIP. Pipila pong maghapon magdamag sa DSWD para makakuha ng AIX. Pipila po sa opisina dyan sa labas po ng Senado para makakuha po ng guarantee letter sa ating mga mambabatas o sa Kongreso. Wala pong pambayad. Ang ibig ko pong sabihin, Mr. President, kulang na kulang po ang ating mga kama sa lahat po ng government hospitals. Therefore, Mr. President, it is high time that we grant the Department of Health the authority to adjust and approve the authorized bed capacities of our hospitals. The growing demand for health services calls for a more responsive and flexible system that can promptly address the needs of our Filipino people. Ito pong panukalang batas na ito ay para po sa kalusugan ng bawat Pilipino. wala pong maiiwan, walang mapapabayaan. At the proper time, Mr. President, I will also be asking questions during the plenary deliberations, not to delay, but to seek clarifications. Maraming salamat po, Ginong Pangulo. Magandang hapon po sa lahat.
Maraming salamat, Senator Erwin Tulfo. Senator Robin Hood Padilla is recognized.
Maraming salamat po, Ginoong Pangulo. Buong puso ko pong pinapahayag ang aking pagnanais na i-co-sponsor ang panukalang batas, Senate Bill number 1508, sa ilalim po ng Committee Report number 12, na nagbibigay sa Department of Health ng kapangyarihang magtakda at mag-aproba ng bed capacity at service capability ng ating mga DOH hospitals. Alam niyo po, sa loob po ng 4 na taong ko dito sa Senado, ako po ay nagpukol ng pansin sa akin sa MAIP upang makatulong po sa ating mga kababayan. Sa realidad, ang karamdaman po kasi at sakuna ay parang unus. Dumarating ng walang abiso. At habang naghihintay ang mga ospital ng bagong batas para makapag-expand, ang mga pasyente naman po ay nag-iintay sa mga pasilyo. Minsan po, hindi na po naaabot ng tulong. Sila po ay inaabutan na ng pagkamatay. Kapag buhay ang nakataya, hindi pwedeng nakatali ang ating health system sa luma at matagal na proseso. Sa panukalang ito, binibigyan natin ng DOH ng kakayahang gumalaw ng mabilis, makatarungan at nakaayon sa pangangailangan ng panahon. Ito ang klase ng batas na nagliligtas, hindi nag-aantay. Ito po ay nakapaloob sa ating saligang batas na dapat po nating tinatayuan at pinaglalaban. Karapatan po ng ating mga kababayan ang health care. Muli, pinupuri ko po at pinasasalamatan ko po si Senator Risa Hontiveros at si Senator Erwin Tulfo at sa lahat po ng mga kasama ko dito, Senator Bongo, sa kanilang mga makataong advokasya. Buong dangal akong nakikisa at sumusuporta po sa panukalang ito. Maraming salamat.
Maraming salamat, Senator Robin Hood Padilla. Majority Leader.
Yes, thank you, Mr. President. We also have, well, he's not here. We'd like to also just submit for the record the sponsorship speech of Senator Christopher Lawrence Bongo. For the record.
Sorry, sir.
Thank you, Mr. President. And also Senator Jinggoy Estrada.
Take note of that. We'll insert
you.
the records.
Thank you, Mr. President. Mr. President, to allow our colleagues to study the measure further, I move to suspend consideration of the measure.
Is there objection? There being none, consideration of Senate Bill number 1508 is hereby suspended.
Mr. President, I move to transfer from the calendar of ordinary business to special orders, Senate Bill number 1512 under Committee Report number 16. So move, Mr. President.
Is there objection? There being none, the motion is approved.
We will ask the Secretary to read the title of the measure.
An act creating an independent People's Commission to investigate anomalies in all government infrastructure projects, defining its powers and functions, appropriating funds therefore and for other purposes.
Mr. President, I move that we recognize the very hardworking sponsor, no other than Senator Francis Kiko Pangilinan, to sponsor the measure.
Senator Francis Kiko Pangilinan is recognized to sponsor the measure.
Maraming salamat, Mr. President, distinguished Majority Leader, to our distinguished colleagues. I rise today to sponsor and co-author Senate Bill number 1512, principally introduced by our Senate President Vicente Soto III, co-authored by Senators Erwin Tulfo and Risa Hontiveros. 6 na araw na nang bahain ang Cebu at maraming bayan sa ating bansa. Dumating at umalis na ulit ang isa pang bagyo, ang Uwan. 52 araw na ng malawakang protesta laban sa flood control scam noong September 21. Patuloy na nakaabang ang ating mga kababayan sa magiging kahihinatnan ng pinakamalaking corruption scandal sa kasaysayan ng ating republika. Hindi lang nilulunod ng puot ang taong bayan, literal na inanod din ang kanilang mga bahay at buhay. Inaanod na rin ang batayang tiwala ng karaniwang mamamayan sa pamalaang may sinumpang tungkulin na pangalagaan ang kanilang interes. Hindi lang hagupit ng kalikasan ang dahilan ng ilang daang pagkamatay at pagkawala sa iba't ibang sulok ng bansa. Hindi lang ito natural disaster, man-made disaster din ito. Malaking dahilan ng man-made disaster na ito ay ang massive systemic corruption. Systemic na parang cancer na kumakalat na sa lahat ng bahagi ng lipunan. Massive dahil sinlawak ng bahang dinulot nito ang korupsyon. Bagyong Uwan, halos buong Pilipinas ang kanyang naging saklaw. Ganito rin itong flood control scandal. Sa maraming bahagi ng mundo, kita natin kung paanong nilalagay na sa sariling kamay ng mga Gen Z at karaniwang mamamayan ang pagpapanagot sa mga may tungkuling nasa katungkulan. Sa pagpapatupad ng katarungan, sa Nepal, sa Indonesia, sa Peru, literal na naghihimagsik ang mga kabataan at nilantad ang korupsyon na sumisira sa kanilang mga buhay. Ito ang konteksto ng ating panukalang batas na palakasin ang Independent Commission on Infrastructure na binuo ng Executive Order 94 sa pamamagitan ng itong committee report. Kailangan natin ng proseso na public, prompt, necessary, the minimum possible under the given circumstances, proportionate to the crimes and established by law. Ang pagiging maagap na parusa, hindi ang kalubhaan ang tanda ng hustisya. O sa panahon pa natin ngayon, kailangan smart and solution-specific, measurable, achievable, realistic, or relevant, at syempre, time-bound. Kaya naman minarapat ng inyong Senate Committee on Justice na itaguyod ang isang tunay na independent, technically capable, at empowered People's Commission para imbestigahan ang mga anomalya sa lahat ng government infrastructure projects. Unprecedented ang kurakot, unprecedented ang bunga ng krimen, kailangan unprecedented din ang pagpapanagot. Kaya binigyan ng panukalang batas na ito ng kapangyarihan ang Independent People's Commission para magsabpina, mag-usig, magsuspinde, mag-freeze ng assets at sundan ang pera saan man ito nandoon. Ika nga, follow the money. The proposed measure expands the powers of the ICI to include the powers of contempt, to cite individuals and entities for contempt, the power to cancel professional licenses of the PRC, the power to grant witness immunity and protection, the power to issue lookout orders and recommend HDO to proper authorities, the power to suspend and blacklist contractors and remove them from PhilJeps, the power to recommend to the President policy measures, the power to temporarily issue closure orders, the power to temporarily sequester assets, the power to deputize the NBI, the PNP, the CIDG, and other law enforcement agencies in the conduct of its investigation. Dulot na rin ng pangalang nito, magsisilbing People's Watchdog ang komisyon. Magkakaroon ito ng fiscal independence at tunay na proteksyon para sa mga kakantang whistleblowers, sa mga citizen monitors, Papaganahin nito ang karaniwang boses para sa tunay na pagpapanagot sa kurakot. Bagamat suklam na suklam tayo, kailangan pa rin ng due process. Ang katarungan ay hindi kasangkapan ng paghihigante. Kailangan public ang mga pandinig, patas at walang pinapanigan ang investigasyon at ang bunga ay nakabatay sa katotohanan at sa batas. Pasanin natin ito sa bawat Pilipinong umaakyat sa kanilang mga bubong, nagdadasal para sa kanilang kaligtasan. Pasanin natin sa bawat magulang na nawalan ng anak sa sakunang pwede namang maiwasan. Tungkulin natin ito sa lahat ng humihingi ng katarungan, ng pananagutan at ng pagbabago. Ang pagpasa sa panukalang batas na ito ay simula pa lamang. Dapat nating tandaan na ang mga batas at komisyon habang makapangyarihan sa papel ay humuhugot ng kanilang tunay na lakas mula sa isang nakatuon, mapagbantay na mamamayan. Ang pinakadakilang kaalyado ng hustisya ay ang mga taong ayaw tumanggap ng impunity, na patuloy na nagbabantay, nagtatanong at nagpapanagot sa mga tagapag-alaga ng kapangyarihan. Ipasa natin ang panukalang batas na ito, hindi bilang isa pang hungkag na kilos, kundi bilang isang bagong tipan sa pagkakaisa ng ating tinig. Hindi natitinag ang ating pagtutol sa katiwalian at hindi natitinag ang ating pagbabantay. Itayo at itaguyod natin ang isang pamahalaan na tunay na mapagkakatiwalaan ng sambayanang Pilipino. For these reasons, Mr. President, distinguished colleagues, I wholeheartedly sponsor Senate Bill number 1215 under Committee Report number 16 and urge its immediate approval. Maraming salamat.
Thank you, Senator Pangilinan, Majority Leader.
Next to sponsor the measure, Mr. President, no other than our Senate President, my dear presiding officer, no other than Senator Vicente C. Soto III.
Our Senate President, Vicente Soto III, is recognized.
Thank you, Mr. President. Mr. Majority Leader, thank you. At the outset, allow me first and foremost to thank Senator Francis Pangilinan, Chairman of the Committee on Justice, for acting with dispatch on this measure that is timely and necessary at this point. Mr. President, every devastating typhoon or monsoon that flooded our streets, severely damaged houses, destroyed livelihood, hampered our day-to-day activities, and claimed lives. We are reminded of the Filipino people's unwavering resiliency. Yes, all right. But this should no longer be the conversation. Resiliency should not be celebrated when accountability is deniably lacking. Filipino people surviving yet another flood should no longer be the topic of the next news article. Our people should not be losing sleep anymore when it is raining, fearing that anytime the flood will destroy their homes. Due to the geography of our country, we are very vulnerable to calamities. The billion-peso budget allocated to flood control projects should have given our people the security that no matter how hard the rain, they are safe. Much has been said about the recent flood control issue that shocked the nation. It is now the time we have taken action. By filing Senate Bill 1215, we now demand accountability for those who took advantage of the flood control and other infrastructure budgets for their personal gain at the expense of the suffering of the people. Ginoong Pangulo, Maraming ang pamintas-mintas eh. May mga nagpipintas pa. Oh, yung Blue Ribbon, hearing na naman. Yung TRICOM ng House, hearing na naman. Yung ICI, wala namang power. Ang dami natin naririnig na gano'n eh. O eto, through this bill, we will be creating a balanced, effective, and most importantly, an independent investigative body tasked to look into this systematic corruption through which billions of pesos intended for infrastructure projects have been lost. Until every person involved is held accountable, until every peso has been recovered, until every Filipino is safe during calamities, we should not stop acting. Again, my thanks to the committee, Chairman, to you and my esteemed colleagues. Hopefully, the immediate passage of this measure. Thank you, Mr. President.
Thank you to our Senate President. Majority Leader.
Ready na yung dalawang bills na Ma'am Risa? Nabasa na. Thank you, Mr. President. Mr. President, we have two last remaining sponsorships before we tackle the budget measure. May we transfer from the calendar, move to suspend consideration of the measure to allow our colleagues to study the measure further, Mr. President.
Mr. Objection. There being none, motion is approved.
Mr. President, I move that we transfer from the calendar for ordinary business to special order, Senate Bill number 1510 under Committee Report number 14.
Mr. Objection. There being none, motion is approved.
May we ask the Secretary to read the title of the measure, Mr. President?
An act establishing a national health service outreach program for senior citizens and indigent persons with functional disabilities, providing for interagency and local government coordination and providing funds therefore.
Thank you, Mr. President. Move that we consider the measure and recognize a distinguished Deputy Majority Floor Leader, Senator Risa Hontiveros, to sponsor the measure.
Mr. Objection. There being none, our Deputy Majority Leader, Senator Hontiveros, is recognized.
Salamat po, Mr. President. Mr. President, distinguished colleagues, magandang gabi po sa inyong lahat. I rise to sponsor the Health Outreach for Seniors and Indigents Program, HOSIP, a national initiative to provide community-based care, assistive devices, and hygiene support for senior citizens and indigent persons with functional disabilities. Functional ability is key to healthy aging or active aging and healthy longevity. It means having the skills and opportunities to live a life you value, to meet needs, learn, move, connect, and contribute. Together with Senator Rafi Tulfo, we aim to identify and register seniors and indigent persons with sensory or mobility challenges, assess their needs through community profiling, and conduct regular visits every 2 months. The program will also provide free assistive devices such as wheelchairs, walkers, hearing aids, eyeglasses, and dentures, and distribute oral care and hygiene kits quarterly to eligible seniors and indigent persons. Through HOSIP, we reaffirm our commitment to care for those who once cared for us and still care for us, and to uplift the lives of the poor and the vulnerable. Let this measure be a step toward a more inclusive, compassionate, and health equitable Philippines, where no senior or indigent person is left behind. Marami pong salamat, Mr. President.
Thank you, Senator Hontiveros. Majority Leader.
Thank you, Mr. President. To allow our colleagues to study the measure further, I move to suspend consideration of the measure.
If there's no objection, motion is approved.
Mr. President, I move that we transfer from the calendar for ordinary business to special orders, Senate Bill number 1511 under Committee Report number 15. I so move, Mr. President.
Is there an objection? There being none, motion is approved.
We ask the Secretary to read the title of the measure.
There's no objection. The Secretary is requested to read the title of the measure.
An act strengthening the protection of patients against hospital detention on grounds of non-payment of hospital bills or medical expenses and providing stiffer penalties for violations thereof. Amending for the purpose RA 9439 entitled An Act Prohibiting the Detention of Patients in Hospitals and Medical Clinics on grounds of non-payment of hospital bills or medical expenses.
May we recognize once again the very hardworking Deputy Majority Floor Leader and Chairperson of the Committee on Health, no other than Senator Risa Hontiveros.
Once again, our Deputy Majority Leader, Senator Risa Hontiveros, is recognized to sponsor the measure.
Salamat po, Mr. President. Mr. President, distinguished colleagues, magandang gabi po sa inyong lahat. I rise today to sponsor a measure that seeks to end a silent cruelty that has for too long haunted the corridors of our hospitals. The unlawful detention of patients and even the withholding of the bodies of the dead because of unpaid hospital bills. This is a practice that cuts across our society. It victimizes the poor, the elderly, solo parents, and even those who simply fell sick at the wrong time. Sa ganitong practice, pinaparusahan nito ang mga may sakit dahil sila'y mahirap. At nilalabag nito, hindi lang ang ating saligang batas, kundi pati ang ating pagkatao bilang tao. No Filipino should ever have to beg to be released from a hospital bed. No grieving family should ever have to ransom the body of a loved one. Katuwang sina Senador Jinggoy Estrada at Erwin Tulfo, we propose to strengthen patient protection against hospital detention, to reaffirm what should have always been true, that healthcare is a right, not a privilege, and that compassion, not capacity to pay, must be the guidepost of our medical institutions.